So you might have seen that the CEO of United Healthcare, the biggest health insurer in the US, was fatally shot just a matter of days ago. And it goes without saying that you probably shouldn't go around shooting people. But if there's one thing that's interesting about it, is the way that it's brought people together. Because people have responded in an interesting manner. I want to give you some context as to why people feel this way about United Healthcare. Because this reaction has transcended barriers. Political, social, whatever barrier. And it's caused other insurers to respond as well. For example, Blue Cross, which is another one of the biggest insurers in the US, within a day of this happening, reversed a change to their anesthesia coverage, which would have put time limits on how long a patient could have received anesthetics while in hospital. For many, many years now, reporters have written at length about the practices that United Healthcare carries out. And it's not just the unwell or the medical staff that are being screwed over, but the everyday regular citizen. And, however you feel about it, anything that brings people together is interesting to me. And I want to help you maybe understand some of the context behind United Healthcare. Because more than 26,000 Americans die each year because of the lack of health insurance. More than twice as many as were murdered. And that alone can give you at least a starting point, right? United Health Group, which is the parent company of United Healthcare, is the 8th biggest company in the world by revenues. And infamously, they say that, with great power comes great responsibility. Except I don't think anyone told United, because on average, 16% of insurance claims are rejected in the healthcare space. For United Healthcare, it's 32%, meaning that around 1 in 3 paying customers has their claim rejected. This just scratches the surface, and we can go a little bit deeper and find out a little bit more. Given that the insurance industry rejects claims at such a high rate, you would expect some of those savings to maybe have been passed on to the consumer. And so I decided to check, how have insurance deductibles and premiums changed over time relative to wages and inflation more broadly? And the answer was not well. Between 2010 and 2020, the cost of deductibles has more than doubled. And the cost of family premiums, the monthly payments, increased by over 55%. And today, low-income families spend close to a third of their income on health insurance premiums. It's not good. Just showing you numbers doesn't really capture the full picture, because sometimes it can be easy to get lost in the numbers and to understand how this actually translates into human impact. And ProPublica just last month published an amazing article about United Healthcare's playbook when it comes to mental health coverage. And this will really help you understand how all of these numbers actually translated into human impact over the years. United Health Group, the parent company, has seen their revenue grow by over 47 billion in the space of a year. And to achieve such massive growth in an industry like healthcare, you need to rely on the same playbook that other industries have relied on, which is optimization through technology. United Healthcare implements an algorithm called ALERT, Algorithms for Effective Report and Treatment, to determine whether or not a person undergoing mental health treatment has had too much therapy. If a therapist passes an arbitrary threshold, they get contacted by what's called a care advocate, who will call them and grill them for providing too much care to their patients. The official term for this is the risk of overutilization of routine outpatient services. What this looks like in practice is pretty crazy, I think. I want to give you a testimony from a patient who had their claim for mental health treatment denied. She says that 2 years ago, my therapist was denied payment for 7 of my mental health sessions she provided. I tried to pay her even though I'm on a limited income, and she wouldn't take the money. If my provider, in her professional opinion, believed I needed those therapy sessions, who is United Health to deny coverage? And if you're curious about what too much therapy actually looks like, it is 30 sessions in 8 months. This was the threshold for initial flagging, which if you fancy yourself as a mathematician is a bit less than once a week. And this might sound like an uncharitable description, right? They were hunting down people for having too much therapy. But it got to the point in New York where the Attorney General actually sued them for it. And they just recently settled for $13 million. These $13 million covered around 34,000 therapy sessions that were missed. And I would just ask you to speculate on what you think the cumulative mental health impact of 34,000 missed therapy sessions would be, because it's not good. And this algorithm remains in place today in the vast majority of the US. The algorithms that United Health have implemented over recent years are officially said to be suggestions, but leaked messages from whistleblowers have implied that workers are being told to stick within 1% of the algorithm's recommendation. The AI that's used to evaluate these claims is notoriously faulty, and they're currently undergoing a lawsuit which claims that it has a 90% error rate, meaning that 90% of the claims that were rejected could be later overturned with an appeal. However, it's unreasonable to expect someone to appeal when they are unwell. It's one of a number of pieces of evidence that the number one priority was not necessarily providing effective healthcare, unsurprisingly, actually. However, even if you're not medical staff or you're not a patient and you're just a healthy American adult, you're actually still getting screwed over by them because United Health specifically exploits the Medicare Advantage plan. Medicare Advantage is a healthcare plan that represents a public-private partnership. People get insurance with a private company, and the company is later refunded by the government. It allows health insurers, which have experience and have vast networks in the healthcare space, to use that, and it allows the government to not necessarily bear the cost of all the infrastructure that they need to provide medical services. And if we understand how it works, you realize that it's not necessarily as good of an idea as it might seem at first. There are some statistics that kind of like live rent-free in my head, specifically one about healthcare spending per person. Because the US notably spends way more than any other comparable country. The UK, which has completely free at the point of service healthcare system, spends less than half the amount per person on healthcare. And this was a number that just never really added up in my head. I didn't understand how the US was able to spend this much money. And understanding the Medicare Advantage plan actually explains a little chunk of this figure a bit more to us. You see, Medicare Advantage works by giving an insurer a fixed amount of money for a healthy person. And that amount of money varies depending on how sick the patient is. So for example, they may get an extra $2,300 if the person is morbidly obese, an extra $2,000 for seizures, an extra $1,200 for chest pain, because the logic is that it would incentivize doctors to fully diagnose patients and to not miss any corners with these Medicare Advantage patients. It's also worth noting that not every extra diagnosis leads to an extra payment. So for example, cataracts are paid out, but only if you contract them due to diabetes. Except there's always a loophole, right? Because United Healthcare wasn't happy with the payouts that they were receiving. And the Wall Street Journal wrote about a number of cases where United Healthcare would actually try and offer people extra money to get more diagnoses out of them. If they felt that the patient's doctor hadn't provided enough diagnoses for the patient to be worth it, they would call the patient and ask if they could send a nurse out to give them a checkup. They would even offer a $50 gift card to encourage them to get this visit by a United nurse. This is completely separate from their actual medical center that they might visit on the regular. And this led to the person mentioned in this article, Gloria, being diagnosed with a condition that she didn't actually have. A condition that led to United Healthcare getting an extra $3,000 and led to her receiving a diagnosis for something that she didn't suffer from. And this isn't just an isolated case. If we look at the number of patients diagnosed with cataracts that were part of United Health, they actually diagnose at a rate 15 times higher than traditional Medicare. And the vast majority of these diagnoses are not done by the patient's doctor. Rather, United Health just adds on diagnoses in order to extract more money out of this Advantage plan. And when you look at conditions that don't lead to an increased payout, you don't see anything near this level. To highlight how egregious this actually is, more than 66,000 Medicare Advantage patients were diagnosed with diabetic cataracts, even though they'd already gotten surgery for it. And it's interesting to consider the fact that United Health is 15 times more likely to diagnose patients with this condition, and yet around 1 in 3 paying customers has their claim rejected. A plan was even hatched to reform the Medicare Advantage plan to prevent this kind of overbilling, but it was shut down after what was described as strong industry opposition. As usual, it does come down to lobbying, because United Health Group is a huge political donor. They donated over $10 million in lobbying in 2023. I visited Open Secrets just to have a look at what their donations looks like. And yeah, you can see they literally give money to everyone. It's not too hard to be surprised as to why there's not been much pushback or much mention of such insurers, except by, independent politicians. When we take even just a brief glance at their list of donations, the cost of medical care in the US is inflated at every step of the process. And United Health did not become the 8th biggest company in the world by revenue just through providing health insurance. Rather, what they've done as well is they've systematically acquired all sorts of different parts of the healthcare stack. So acquiring groups of doctors, pharmacies, nursing homes, and adding those to the stack. Therefore, they can effectively control how much you're charged at every step of the process. And they can ensure that no matter where you are in your treatment, you're being seen by United Health Group. There are laws in place that require insurers to take no more than around 15 to 20% of the premium for like profits. But by acquiring other parts of the stack, they were able to systematically inflate prices across the board. And people have seen that reflected in higher medical costs. And so it really feels like it's reached a boiling point. There is only so far you can push people before one of them eventually snaps. However, the thing is, United Healthcare isn't necessarily an outlier. It's simply the most egregious example of an infamously quite broken healthcare system where insurers are rewarded for not actually providing care, for doing anything but providing medical care. And the impact from a civilian perspective has been witnessing death, injury, and illness throughout their lives. I think a lot of the reaction hasn't necessarily been sparked by knowledge of the specifics of the scale of the criminal activities that they've engaged in over the years. But it's about something much more visceral, right? About an understanding that their health has been effectively sold off to the highest bidder. And you don't have to necessarily know about specific violations of Medicare Advantage plans to be able to feel that. Nor do you have to know about how they treat doctors as well. But rather, you just have to know about how they treat you, your family, and your peers, which appears to have been almost unanimously negative. The lowest income people spend close to a third of their income simply servicing the cost of having health insurance, which is extremely unlikely to pay in their moment of deepest need. And while I can't necessarily endorse anything anyone has done, I can say that I am surprised that this hasn't happened sooner. I think many people have a mental block where causing a death in a legal manner is seen as not being as bad as causing a death through an illegal manner. And it's not too much of a surprise that it was a matter of time before someone felt like the legal system didn't adequately punish people who caused deaths in ways that were seen as being within the law. That one person has come to represent an idea that's way broader than just them. It represents deep frustration that people have felt for many years, and it's only now being directed towards the people who have perpetuated the system, which has caused them so much pain over the years, and which has affected people across the nation in a way that most issues really don't.